I'm Dr. Peter Rosenquist. I'm a physician and psychiatrist. I'm the Vice Chair of Psychiatry at Georgia Regents University Medical College of Georgia, and I'm the Director of Therapeutic Neurostimulation.
So how do you think today's session went?
It was well attended. When we originally conceived of this APA course about 5 or 6 years ago, it was going to be for the general psychiatrist, those folks who may not be doing ECT. This is ECT for the general psychiatrist, an update. But in fact, we have so many people that are ECT practitioners that it is a wonderful learning experience for those individuals who do this procedure to interact with an experienced faculty who regularly treat patients with ECT.
So one of your tasks was giving an overview of the research involving ECT. How does the effectiveness of ECT compare with that of pharmacotherapies?
So we have some specific data showing that overall in those patients who have been compared with ECT versus pharmacotherapy in treatment-resistant cases, we understand that part of the problem is that medication resistance leads people to ECT, and even in those cases, we're able to achieve good outcomes with our patients, although it is true that treatment resistance can dampen the effects of ECT. For the most part, what we would argue is that the ECT is for the severely ill patient rather than looking at treatment resistance as the primary reason that people would come to ECT.
So are there any populations that respond better to ECT?
Yes, so we know that there are a number of predictors for ECT response. One of these is the presence of psychotic depression. ECT can be effective to 80 to 90% in this population. We know that the elderly respond preferentially to ECT.
And what about for schizophrenia?
So this is one thing that in the United States has perhaps fallen into disuse with ECT, or in comparison with the rest of the world where schizophrenia may be the primary indication for doing ECT. But there is data to support its use. We showed some data today speaking to the combination of clozapine with ECT, and one of the things we wanted to make sure that our participants knew today is that you're really probably not done treating a patient with schizophrenia if you've not tried clozapine, and if you've not tried clozapine plus ECT, because there's some very good work recently done by Dr. Petrides and others showing that the combination is far superior than to either of those treatments alone.
You also mentioned some of the shortcomings of ECT. What was that?
So I'm not sure I would use the word shortcomings. I think what I would say is it's a very effective treatment for a certain population of individuals. It's not for everyone. We certainly understand that there are risks and benefits to every treatment, and those ECT practitioners and those who refer for ECT need to understand the nature of their patient's illness and whether they in fact are healthy enough to have ECT.
Thank you so much.
You're welcome.